NHS Scotland Academy is critical in terms of supporting the recovery plan across NHS Scotland. Obviously the National Endoscopy training programme is supporting that in terms of some of those services having been paused during the pandemic, so we're trying to support those services to recover. I think a really good example of that is that we have colleagues from different parts of Scotland now come to the Golden Jubilee for immersion training in endoscopy, which means that they can complete lists that will enable them to get their medical training completed.
The purpose of the Academy is to develop really a fast-paced delivery of learning and to increase speed of learning and education for the development of the workforce.
I thought it may be helpful just to provide a bit more detail within each of our programme areas. So within our Widening Access and Sustainable Delivery programme, Dylan leads the teams looking at our NHS Scotland Youth Academy developments, and I think most people are aware now that we have 6 huddles across the country looking at opportunities to bring young people into health and social care. And the team are also working with colleagues across the country on how we support armed forces service leavers and veterans to join health and social care. The National Endoscopy Training Programme has been in place the longest. It was one of our signature programmes, and we now have a range of different activities that we're focusing on there. We're supporting the JAG accreditation of training centres across Scotland. We've got work streams supporting different clinical areas including colonoscopy, upper GI endoscopy, polypectomy, and we're going to be moving on to developing a programme for transnasal endoscopy. Within the National Treatment Centres programme that Darren is leading on, we have now moved on to having our 3rd cohort of learners on the Foundations of Perioperative Practice programme. We're about to welcome our first cohort into the Anaesthetic Assistance programme this summer, and the team are continuing to work on the development of a programme for surgical first assistance.
So I particularly work around the National Treatment Centre programmes. So we have a range of programmes that are there to accelerate the learning of postgraduate students to make them a valuable member of the workforce as soon as they can be after qualifying. So at the moment I manage 3 programmes. 2 programmes are currently running in full. So I'm currently involved with the Accelerated Perioperative programme, which focuses primarily on nurses who are going to work in the perioperative environment. So they're working in theatre, we're developing their scrub skills and their recovery skills to enable them to contribute to the workforce. We've also got ready to start running an accelerated anaesthetic assistant programme. So the idea of that course specifically is to look at anaesthetic assistants, of which there are a significant shortage in the Scottish workforce, and we're looking to develop the skills for them. So what we've done is develop a selection of programmes that enable learners to increase what they're doing at a faster rate. So basically what they do is they get given the high risk elements that they rarely see. So our approach is, what we make sure is that they get access to high risk, low exposure content. So we're hoping that the accelerated programme will work very simply by, if we can expose them to those things that they rarely see but are so fundamental to their role, they must be able to deal with those emergencies. We're enhancing the training, increasing the speed at which they can gain those skills, and we're utilising that through simulation. Both of those programmes are due to go through a dispersed model to go nationwide, as well as just be based with the Academy and meeting the Academy's role to go across the country. The other element that's coming on board is a surgical first assistant course, and we're currently looking at the surgical first assistant programme, which again is fully in development at the moment. So we've started looking at stakeholder involvement and things around that.
The accelerated learning offers the learners a really good opportunity for learning. We ensure that as part of our accelerated learning development that we're maximising the learner's opportunity for success, that the accelerated programmes and developments are aligned to their current role, so there is that work-based learning development, that we have contextualised curriculum content, and we have an opportunity for really contextualised skills and simulation learning. So bringing together those key elements, it makes the educational programme and development that we're delivering completely aligned to the learner's role
So basically I await confirmation from our national treatment centre groups. They give us the confirmation for the learners to come on, and then I would contact the learners directly and get them arranged on the course. They're able to learn while they're currently doing their current role, and they're upskilling and developing new skills, so they're actually really excited for coming on the courses.
Within the broader National Workforce Programme, we have our well-developed National Clinical Skills for Pharmacists programme, where we have colleagues coming from across Scotland to support their independent prescribing qualification.
Well, Clinical Skills for Pharmacists is a national programme brought out as part of one of the Pharmacy First projects in Scotland associated with National Education Scotland. The main component of that is the independent prescribing academic component that's run by either Robert Gordon University or Strathclyde University in terms of the academic side of things. The practical element is something that's been designed and run through Dundee, and we have provided in the west of Scotland the ability for pharmacists to participate in this programme and having some experience in either communication skills or practical clinical training. So we've seen large numbers of people coming through this programme and being experienced to some basic training in clinical skills. This allows pharmacists then to see patients with minor ailments and problems to either manage them, diagnose them, or make appropriate referral to other clinicians, and it avoids the necessity for them to see either a general practitioner or attend the emergency departments.
We developed digital learning resources for colleagues that are new to health and social care, and again there's been a really positive uptake. In fact, the last time I looked at figures in July of 2022, in excess of 1,200 people across the country have accessed those digital learning resources. We're moving forward positively in terms of developing, again, digital learning resources for NMC OSCE preparation. So we launched resources for educators in May, and our resources for the international nurses coming to Scotland went live in June.
We've got a fantastic IT team who have helped develop sort of activities that our learners can undertake before they attend workshops that are in person. So they're doing online learning, which is contributing to the valuable time when they are on site and actually doing things. They've got a lot of information beforehand, and they can then start to apply it early on, which again links directly to their learning. And what we also have is more learning that takes place after. So once they've done some physical activity, they've engaged in our workshops and our face-to-face activity, they then leave here, but they go and have access to more learning resources, which again support what they've picked up over the last few days as well as what they've developed. So there are tests around that, and very informative, very useful for them to confirm their learning, for us to confirm their development. And then what we've also got is systems that then speak to their employer, and their employer can feedback as how they're performing in their work-based environment as well, and how the course is developing and contributing to the workforce.
The collaboration in the academy between Golden Jubilee and NES is a real source of strength, I think. On the digital side, NES provides expertise and also the kind of the digital environment, and NES provides educational expertise and experience as well. And then from Golden Jubilee, we have a collection of clinical experts that I work with to produce our digital learning resources as well. When we begin to develop our learning programs, we start with quite a large stakeholder group from across the NHS and also, as I've said, external organisations. What that does is help to ensure that we're not duplicating any effort, but also that we're getting the most effective learning programme that we can at the end. From there, we start to work with subject matter experts. I talk to them and we start to develop the content, and then it's really a question of cycles of development and review, and finally some technical and user testing at the end before any resources can go live as part of the learning programs. Digital learning has a really vital role in supporting the recovery plan. Obviously, digital learning has several important benefits, and I think for the Once for Scotland approach, there's that consistency of quality that you can get in developing digital resources, and also there's this efficiency of production as well, where you can have one team producing resources that can be used again and again and across the country, and there's that scale too, that you could have a webinar or something online that is accessed by hundreds or thousands even of people, which again I think is really useful for the recovery plan. There's also the fact it can be remote, and I think that contributes to a kind of an equity of access to our education, so people in remote locations can access the resources just as easily as anyone else.
So one of the things we've had back is lots of feedback about the speed that those learners have been turning around, and that the boards are trying to get learners onto the courses again to increase their numbers, and we've certainly, the anaesthetic course is about to run, and is still very much in that final stages of tidying everything up and getting everything ready to go, but we're already getting learners coming onto that, and we're getting contacts from boards very early on saying, when can we get spaces, we need spaces and things like that. So yeah, there is an enthusiasm across the boards, and I think what they've noticed with the courses that we have been running is that we are delivering to them staff that are contributing to the workforce very early on into the programme.
We're also still keen to develop a programme to support sonographers through the National Ultrasound Training Programme, and we'll continue to provide updates on that. We've now got plans in place, been working with the architects and the facilities team, the estates team within Golden Jubilee, to repurpose an area within the Golden Jubilee campus so that we can have an NHS Scotland Academy Skills and Simulation Centre here. And in addition to that, we've got a range of amazing colleagues working across all of the teams, in our programme office, our planning team, digital team and our faculty development team, as well as working closely with the different parts of the Clinical Skills Managed Education Network in Scotland.
It is fast-paced. I think what we have is very much an approach that the delivery is fast-paced, so the learners benefit and the workforce benefits. What we also have as an organisation is a desire for our development to be fast-paced. So not only do we commit to a course that is going to help the learner and learn quicker and contribute to the workforce early, but we also develop the courses at pace. So again, we're trying to eliminate the delays not only in the development of the course and the delivery and ultimately the learner, but we're trying to cover all aspects of that and speed everything up.
So we've made great progress across a range of different programmes since the establishment of NHS Scotland Academy in 2021. And what we continue to do is engage with a whole range of stakeholders across the system in Scotland to make sure that we're responding to some of the challenges within the workforce and training for the whole system. We continue to work with partners across the country to explore opportunities for further training programmes within NHS Scotland Academy, and we will keep everyone up to date through different forms of communication in terms of any new programmes that are coming on board.